My name is Tasha Story, and I'm currently the co-director of an organization called Ewaza, which is a not-for-profit organization that works at the intersection of youth advocacy, skills development, science communication, and public engagement to bring together the biomedicine of disease with its social impact. So I got really interested in community engagement in the last year of my PhD. So I did a PhD in very lab-based PhD in molecular microbacteriology, focused on understanding drug-resistant TB. And while I was doing my PhD, I started feeling uncomfortable that I was working on a disease that still to this day kills more South Africans than anything else. But I had never really met anyone or engaged with anyone that had been affected by the disease. And I think this highlights two things. One is that TB is a disease of inequality in South Africa. And so that's why, being a privileged person, I hadn't really engaged with anyone who had been affected by TB. And two, at the time, so this was in 2013, there weren't very many spaces for basic lab scientists to engage with people who were affected by the diseases that they were studying. Ewaza is very transdisciplinary, so it's two people that established the organization from very different fields. So molecular biology, molecular microbiology, and fine arts. So very different. We had to learn to understand each other's language around work. And it's genuine collaboration. So it's not like a scientist commissioning an artist for a specific project. It's genuine collaboration. And there's often tension around that. But I think that there's also a magic when that tension is resolved. We try to be, as far as possible, totally youth-driven or participant-driven, and to be very responsive for what's happening in the communities that we work in, which are mostly communities and townships and informal settlements in South Africa. South Africa's got, in terms of ecosystem, a very strong research infrastructure. I think we're formally classified as a middle-income country, and South Africa's got a really good clinical and basic biomedical research infrastructure, so very good universities, very good institutes, some contract research organizations as well. And within that, there's a lot of community engagement that has to happen ethically. So I think there's a long history and tradition of community engagement in South Africa. And in some ways, I think that's crossed over. A lot of the people who work in community engagement also wear double hats as civil society members, because South Africa's got a strong history of civil society as well. And so I think in South Africa, the field's come a long way. There's still lots of things that need to change in terms of equity, power sharing, genuine involvement and co-creation. I don't think we're there yet, but I think the field's grown a lot in the last 10 to 15 years. I see among young people that I work with on the academic side, the biomedical side, and among some of the more senior people, a greater appreciation about the value of the work. So it's starting to shift from being something that we just have to do to tick a box to something that we think can actually make a difference. I don't think that's fully formed yet, but I do see green shoots of that happening, and I think it's really important that we nurture that. I think what the CFE work has shown me is there's a huge network of people out there doing this kind of work. And it's been really nice to see some of the innovations in this work, not just around health. So get inspired from other areas like climate and the development sector, and people doing some really interesting work. So it's been great to see that coverage of the work, and that's been really inspiring. And I think it's woken me up to seeing how many people are working in this field and how much we can learn from and work together. The other thing that I think is really interesting from the CFE work is how we're progressing on a more, I want to call it a conceptual theoretical level. It's interesting to see the practical work being done, but also the intellectual work and how that's changing and growing. And I think that's often when a field develops and grows. If you think of it like a traditional field like microbiology or immunology, there's the doing in the lab and there's the theory. And I think both are starting to really grow, which is really nice. I would like to see some really interesting local work that is very relevant to the geographies or the spaces that people are working in. So really well considered around what people need on a local scale. But then I think not to lose the global perspective, but really finding a way to balance that out and work across the spectrum of influence from very local to global. This came out in our place-based workshop in South Africa from participants, where community engagement practitioners who had been involved in big clinical trials for COVID vaccines in South Africa expressed how actually hurt they were that we as South Africans got involved in these clinical trials. We're producing high quality data around the efficacy of COVID vaccines, but couldn't access them after that. And I think this indicates the structural challenges around equity in global health. I think it's a very key example and classic example around how you've got a country contributing to data policy, but can't get vaccines. So there were countries in the global north that were vaccinating their populations once, twice over. And in South Africa, we were still sitting and couldn't access vaccines. And I think it made people feel really powerless because even with very high level advocacy, South Africa still couldn't access those vaccines. And I think it shows how we can do the local work, which is really important, but that has to somehow integrate with advocacy around some of the bigger structural factors that land lack of equity. And then the other thing that I'd really like to see from the work is it actually making a difference in people's lives. So on the ground, people that are most affected by specific issues, I think that's where my greatest passion lies, and seeing it benefit people in that way, I think is really, really important. Then I think we've done a good job.